And then the administration set forth a very clear and very difficult goal, and that was to begin to move Ulster County away from what was a very challenged health department into one where we become the best health department in the entire region, and then ultimately the healthiest county in all of New York State. That goal really can only be attained with people who make incredible investments in time and passionate effort, and that's very much what we now have. At the time, we made those major changes, and then during that process brought in Dr. Lamar Hasbrook, who now we are, again, we will miss Dr. Hasbrook greatly. He was a wonderful addition to our community, helped make some tremendous change while he was here. And I think it's just as much a testament to the Ulster County Health Department employees as it is to Dr. Hasbrook's incredible talent that he has now been named the Director of Public Health in the state of Illinois. With all that said, that is both the past and it takes us to where we are today. And where we are today is in a moment that I'm very excited for as well. Dr. Hasbrook was the perfect person at that time, and now we're talking about finding the perfect person to build on that foundation and continue to make Ulster County move in the direction of becoming the healthiest county in all of New York State. And so I cannot be more pleased to introduce to you the new Commissioner of Public Health and Mental Health for Ulster County, and that is Dr. Carol Smith. And you get that without the phone call. I hope that's not Illinois calling for her. Anyway, I think it's really one of those moments when we get to talk about kind of where we're going and Dr. Smith and what she brings to the table. I couldn't be more pleased, again, as the county executive, to be able to have somebody not only with the incredible talent administratively, but also the frontline experience as a physician and the capacity as a public health educator. Things that are imperative, that be skills that are embodied in someone who is going to try to improve the public health of Ulster County. The new rankings are out. We continue to make improvement. But as I tell everybody, we have a long way to go to get to where we want to be, and that is to become the healthiest county in all of New York State. And so, you have the resumes, you understand the qualifications, the skill sets. I think it's important that you have an opportunity to be able to meet Dr. Smith. And so, again, please don't hesitate to ask questions. Dr. Smith, please.
Thank you.
You are more than welcome, and welcome aboard.
Thank you so much. And I do want to say that I am thrilled and honored to join your team. And I really look forward to promoting your mission of making this the healthiest county in the state. I think we're going to put our name on the national map too.
Well, I'm
At least that's
excited.
my goal, in a positive way.
So again, please don't hesitate.
Well, I guess I'll start with the procedural thing. I'm assuming this needs to get approved by the county legislature.
Absolutely.
And
What will take, so you understand time frames for that?
Mm-hmm.
Dr. Smith will start as the interim health commissioner and mental health commissioner on May 7th. We will bring forward the legislation to the next legislative session. Again, their legislative session is tonight.
Mm-hmm.
So we just think it's fair and appropriate to give them time to be able to do their due diligence and be able to move forward. We'll bring it forward at the May meeting.
Can you talk to me a little bit about your experience? You'll be leading the county health department. What experience do you have that sort of prepares you for that?
I've been working in Ulster County now since the year 2000, so this is my 12th year professionally. I worked with Kingston Hospital as their medical director for Kingston Works. I'm currently medical director for Occupational Health Services at Emergency One. I've had the opportunity to interface not only with the residents of this county as a physician caring for them, but with the business community of this county as well, and meeting their needs, their occupational health needs, and they're huge. We are talking about all of the bus and truck drivers, the Department of Transportation physicals, OSHA's regulations, bloodborne pathogens, their respirator physical requirements, their hearing conservation requirements. So the business community has their obligation to their employees as per the standards that OSHA has put forth, and OSHA has had huge successes in reducing the deaths in the occupational world in terms of the workplace deaths and injuries. I think I've been active in terms of making a difference with different companies in this community. And as medical director in both the Kingston Hospital program and currently in the urgent care world that I'm working in, I do believe that I have been the resource person, I've been the go-to person and the lead person in terms of setting standards, setting quality parameters. I do have my master's in public health. I did work with the Dutchess County Department of Health in preparing a capstone project in Lyme disease. So I do have about 12 years of experience in this county and building on the experiences in this county, and I believe that does prepare me for this role. I'm excited about it.
That's something we're also very excited about, and that is to be able to have a Ulster County physician. We have such a wonderful pool of talent to be able to choose from. It's such an exciting opportunity that we have here. And again, where we did major reforms to make Ulster County's health department one of the best in the entire region now, there's been a strong foundation created, and now the exciting part is kind of where we go next, how we begin to really move it forward and begin to make those kind of huge leaps that we think are possible in overall public health.
How do you gauge Ulster being the healthiest county in New York, and how do you get to that point?
There are wonderful groups that get together, like the Brookings Institute, and there's others as well that do evaluations on a multitude of matrix that they do to be able to make those determinations.
Well, let me ask you then. I know the one you'd referenced and the one that's been in the news recently was the Robert Wood Foundation.
Sure.
They're 29th in the state, up from 33rd in 2010. Yeah, what are really your priorities coming in to not just to boost in the rankings, but really what are the biggest issues that public and mental health issues you think Ulster County needs to address?
The rankings are really based on some very sound parameters in terms of what are those behavioral, what are those environmental issues that really impact health, and what can we do to change health for the better. Certainly there are things that happen beyond our control, but there are things that are under our control. One of the huge things certainly is tobacco use among adults in our county. It's actually higher than the national benchmark and in New York State. So, really working aggressively toward that goal of reducing the numbers of smokers that we have in our community, I think will impact health dramatically, both in cardiac issues and just about every other issue you can think of, respiratory issues that smoking will impact. Obesity is another major one. The great increase in the numbers of cases of childhood diabetes and in diabetes in general among the adult population, there's a direct correlation between obesity and these issues. We do have a high accident rate. One of the problems of using alcohol and drugs certainly is that, there are folks out there who are driving under impaired conditions that, and educating the youth in a very aggressive way about where that can lead. There are certainly a number of issues that become part of that ranking standards, and they're really quite, those are some of the major ones. There are others. And of course, other situations can impact health, including resources to healthy foods. I think the fact that we're publicizing the caloric values on all of the fast food restaurants is huge. When somebody might have ordered one thing and then they look and then decide to order something that may be less of an impact on them in terms of the caloric value, it's important. So education's a huge piece in helping to modify behaviors. I think we as physicians, we've been told for a long time that when a doctor tells somebody to quit smoking and helps them achieve a quit date, that has one of the strongest impacts on them actually changing that behavior. So, these are the things that enter into that equation as to why one county may be healthier than others, those statistics. And I think that those are some of the things that we can really actively address from our own standpoint here, in terms of elevating our population, in terms of educating them in that sense, and helping them to achieve a better, healthier lifestyle for themselves and their children. And, I've been educating the community for a long time. I've spoken on a number of occasions on some of these various issues. I've taken care of a lot of our public employees, and I really do hope that we can make a difference, and I'm going to very actively work in that regard.
I think it's also, and this is where I think Dr. Smith will fulfill a really tremendous role, and that is expanding our involvement with our partners. There are so many health partners for our community. It's impossible to contemplate a government doing this in and of itself. It's not possible. So the question really is, with folks like our hospital partners, the many non-for-profits that we interface with, the physicians community, obviously our Board of Health as well, and all of their involvements are, as well as really all the different concerned stakeholders in this process. That's one of the exciting things as well, is trying to create that multiplier effect, the synergies that really come with the health department that utilizes that model versus trying to do everything itself. So we're excited about what that means.
You got it, Rob.
Tell us about the selection process. How much time was taken? How many candidates were looked at? And were we looking only in Ulster County for a replacement?
Well, clearly, we like to look internally. That's a very important concept to me, to be able to look internally because we have such a great talent pool right here in Ulster County. That's an important concept. We aggressively look for the best possible choice. And I tell everybody, it's not just for this position, it's for every position that we ever examine. Because I have a responsibility to the 183,000 people of Ulster County to choose the best possible candidates for every single job that we ever fill, okay? And to also do it in a way that not only puts the community's best interest at heart, but also comes at it from a perspective of trying to make sure that we're doing it in the most cost-effective way. And that's why we run a very lean operation here, but get a lot of things accomplished. I would say we are collectively 10% smaller, but deliver more services than ever before in Ulster County's history.
I'm sorry, Carol, I didn't introduce myself. I'm Michael Novenson with the Times Herald Record. It's nice to meet you. Wanted to ask you, what obligation, if any, do you think county government has to provide mental health services?
Well, before you answer that question, I just want you to understand, I watched how fast he ran. He is really doing a wonderful job. He ran the Kingston Classic recently.
You saw me?
I did. Speeding along, so I was very impressed. Doing your part. Mental health again. I think, again, I will leave this for Dr. Smith to talk about, but from a logistics perspective, and more of a public policy perspective, I think is probably a way of looking at this. It's easy to get caught up in the streamlining effect and a whole host of other things that are involved in this. These, at its core, we believed in putting the mental health operation with our public health perspective because we didn't believe there should be a separation. We believe that there is a undue stigma placed on mental illness, and that by bringing mental health and the county's public health operations together, then we can begin the process of being able to kind of erase that line that should never exist.
I'm going to second that. I think, health is by nature a multifactorial type of thing. Everything impacts everything else in terms of, there should be no line between mental health and physical health. They're intertwined physiologically in every other way. And I have a very kind of holistic sense of what health is, and I really believe that, certainly by bringing them together, that they are by nature to be together. The separation was an artificial sort of a thing to begin with. And I fully support your decision to merge the two and to take away the stigma that somehow mental health is something different and should be separated from health in general.
Any other questions? Excellent.
By the way, not every press conference goes this smoothly.